So before I started having these mood swings, I was very decisive. I knew what I wanted, and most of the time I got that. And there was no question about which way I wanted to go in life, what decorating scheme I wanted to use on whatever it is that I was focusing on at the time. And I had always had a very strong career path and knew what I wanted to be. I'm Paula Staggs, 67 years old. I'm a registered nurse, and at present I work for a large hospital system in South Florida, and I'm over quality, safety, and patient experience. I'm married to Jerry, my husband, and I have a son and daughter-in-law, Lee and Grace, and 2 dogs, a Havanese and an Aussie Doodle, who do everything with us, include going to dinner. We play a little bit of golf. My favorite hobby, I would have to say, unfortunately, is shopping. And I am very good at it. I can always find a bargain and always find a way to spend too much money. My favorite thing too is also I'm a little bit of an artist, and I like to paint acrylic on canvas. I had a very difficult time making decisions because my mood swung so much, and I couldn't keep up with myself. It's just very difficult to make a decision, no matter how simple it might be, because as your mood swings, so does your perspective. Things even as simple as like decorating my house, picking out wallpaper. I couldn't quite get to that final decision, and it was very frustrating, and I didn't understand what was happening and why. I didn't understand while I was waking up in the middle of the night either. You think, okay, what did I do wrong? Why am I not living right or something? Why can't I sleep? But it is a very disturbing feeling that you have as your hormones become more and more imbalanced. So I had a hysterectomy due to severe abdominal pain caused by endometriosis and fibroids. And that was in 2003. And the symptoms of menopause so increasingly got worse over the 2 years following, which sent me on a journey of trying to alleviate those symptoms. It was very difficult for me to find a physician, someone that was experienced in understanding the balance of hormone and and how that affects the well-being of the females.
Dr. Angelo Gousse, board-certified urologist, also certified in female pelvic medicine and reconstructive surgery. Also, I happen to be a specialist in hormonal replacement therapy, not only in men, but also in women. Menopause, in essence, is a medical term that is used when a woman stops having their regular menstrual period for 1 year. So you have to have 12 consecutive months of not having any period whatsoever to really be classified as someone who has achieved menopause. Women who have had their uterus removed, you got to use hormonal parameters to clearly characterize the state of menopause if the hormones have been low for more than a year. There's a pre-menopause where the hormones start declining, but they don't go to a very, very low level. So these women often have what we call irregular menstrual periods, meaning they have their periods some months they don't have it, they skip. It doesn't come in a regular pattern. So that is an indicator that the rhythm of the hormone rhythm has been disrupted, and that the pituitary gonadal axis, which basically mean when the brain also has hormone that is sending signal to the ovaries, to the genitalia, are getting dysregulated. They don't have the normal regulation. And therefore, you get the premenopausal state. It is possible to have hormonal imbalances which predate menopause itself, and there's the premenopausal state where you don't actually have menopause, but your hormones are fluctuating or your hormones are abnormal for whatever reason. Sometimes it's temporary, sometimes it's because of stress, sometimes it's because of many other things or other drugs that were given to you or trauma experience. Yes, that exists, and some of these women, they come to me and we're able to evaluate them, and most of the time we have been able to help them. But that's absolutely possible. Many younger women are developing hormonal changes and hormonal imbalances, not necessarily related to menopause. You have to understand the body is very complex. It has to do with the interplay with organs that are in the brain, the hypothalamus, the pituitary gland, all the female organs. They work together like a concert. They're not isolated, and they're sending message all the time to each other. So something happening in your brain or something like that can have effect on other parts of your body. So people who understand the physiology of all these hormones will clearly be able to identify these patients and help them. This is the testosterone pellet. And as you can see, based on all the lab work, this is the dosage that we plan to use. Women need testosterone. A lot of people don't realize that the body in the woman, produces, testosterone, and it's a much lower amount than what men have, and there are other organs besides the ovaries that are involved in testosterone production. The adrenal glands are involved to some degree, and women, they have their adrenal glands as well, so, and these hormones were underappreciated, let's call it like that, by other clinicians, and never thought of, although because they were in small amount in the female, they were thought they were not significant, which is not necessarily true. The fact that the amount in the blood of the woman is much lower than that in the man doesn't mean that lower amount was not very clinically significant and played an important role. We know now that menopause causes these hormone levels of testosterone to drop, and when that happens, we know that the libido in the female drops significantly, and other changes in terms of their energy level, their focus level drops, very similar to the man. And so it plays an important function, obviously. I wanted to see all the parameters of all the labs.
Okay.
So I could have a bit. One of the common symptoms includes what is called hot flashes. So sometimes you feel all of a sudden you feel hot, and then your body temperature changes. So women who have achieved menopause often will experience that, and it could be very bothersome. Some women might have noticed some changes in their sleeping habits. like they have, difficulty to fall asleep. Some women, feel they have less energy, or go into some type of mood changes, or even frank depression. There are changes that, that they notice in terms of how they interact with their partners or other individuals. All these are very classic, I would say, signs of what we call menopause.
I think the most hated symptom was the severe mood swings. Most frequently, the people that are a victim of those mood swings are the ones that you love the most. And it's just hard to see that reaction, and then you don't realize what you've done, sometimes until a day later. And it's not a very good feeling to know that you were the cause. I think that it definitely was very taxing on my husband and I's relationship during that time, especially compounded by the fact that usually there was a lot of sleepless nights due to just restlessness and also night sweats. So those were also contributing factors to really putting a lot of stress on the relationship. The first thing that we tried in order to alleviate the menopause symptoms were creams, and that was not successful. From creams, we advanced to patches. From patches, we went to oral medications. Then we tried a little bit of oral medications with some lab work to basically prescribe the dosages, and then tried injections. None of those things seemed to work. We found Dr. Gousse to take care of a problem with my husband. I was very impressed with his innovation and the leading edge technology of all the services he provided. He solved a very severe urinary urgency problem that my husband was having. And we had some discussions about my issues with hormone replacement therapy and my struggle to find someone to provide the services. Dr. Gousse was someone that, first of all, had experience in the facilities to actually provide bioidentical hormone replacement therapy with pellets. There are not very many of them in the Treasure Coast.
Yeah, the pellets, the pellets get implanted underneath of the subcutaneous tissue on the fat here, and then they get absorbed into the system. So the pellets they look like grains of rice, or very tiny little, particular structures that have hormone embedded in them. And it is possible to take these hormone pellets, they look like grain of rice, and implant them in the fatty tissue, usually in the buttock area, or they can even be implanted in the flank area. Of course, under anesthetic. It's an office procedure, it's not a surgery. It's just like inserting an IV, really, but instead of putting fluid into a big needle, you put the pellets in the fatty tissue. It takes about a minute or two to insert the pellets, but the big advantage of the pellets is that they deliver a slow dosage daily. So it more mimics your natural hormone delivery. And they can last up to, let's say, 4 months or 5 or 6 months. So basically, it is seamless.
In terms of the discomfort, I would say it's sore for a couple of days, but no more sore than when you would go with a bad infection and you had to have a shot of penicillin. It just feels like that in your hip. Of course, it is an open wound, so you need to take care of it for a few days until it closes up. But other than that, it doesn't really interfere with your activities of daily living at all.
Changes completely your metabolism. Essentially what it does is, all the hormones you were lacking that were important for you to basically live a life that is pretty normal could be replaced through these small little pellets.
So within a week, my symptoms started to lessen significantly, and I could tell that my mood was much more stable, that my sleeping was improved, and it progressively got better from there. And the duration of that was probably about 5 months or a little bit plus.
So these pellets deliver more of a constant level of hormone, and they can last up to, let's say, 4 months or 5 or 6 months. So basically, it is seamless. So you don't have to remember every day to do something to have those hormones. So it's a more natural way, I would think, to replace your hormone. And particularly if you use what is called bioidentical hormones, which are hormones placed in those pellets that are derived from plants. Because there are two types of hormones, particularly with testosterone. You could have testosterone that is a chemical, so it resembles the true testosterone in your body, versus the bioidentical is the exact molecule, and the bioidentical testosterone pellets are derived from plants. So they're plant derived. Not only are they plant derived, but also they're identical to your normal hormones. Try to explain to patients the way it works is, it's like once you reach menopause, what happens is you live in the same room, but all the electricity has been turned off. And then when you get the hormones, they restore your electricity. So you have a choice of living in that room with no electricity, or reestablishing the electricity.
I want you to turn the lights on for me.
Yeah. Now, it's very important to note that before you give those pellets, you have to know exactly what dosage of pellets to give. And the way you know that is by obtaining blood levels of several different types of hormones and several different types of parameters that must be very well calculated in order to design those pellets. So a pellet for patient A, for Jacqueline, might not be the pellets for Paula, might not be for the pellets for Jane. So every patient is different, and those pellets are designed just for that particular individual, based mostly on their symptoms, but more importantly, on their lab results, which we order prior to starting the therapy, and also after the insertion of the pellet. There are blood levels that we monitor to make sure that the patients have remained safe. So pellet replacement therapy, testosterone replacement therapy, hormone replacement therapy is actually extremely safe, but it must be done in experienced hands, and individuals who have the proper training, the proper knowledge, and are very careful in terms of the way they monitor patients who receive hormone replacement therapy. There's some insurance which cover the pellets, but it depends on this type of pellet. But many times the insurance don't cover it. But it depends on what you consider. Often those prices are not exorbitant in terms of people, what they do to get better. If you consider many women, do breast implant, they take care of their hair, take care of their nails. It's really within the price ranges of women who get Botox for their face, who do their lips, who get complicated makeups or stuff like that. It's not like exorbitant amount. But, I think women nowadays, many of them, understand that the gratification they have, the personal gratification they have by feeling better and looking better is worth, the extra dollars that they spend to complement their entire, I feel good, and I think it helps them all over. And when a patient, man or woman, feels good and they like the way they look, they like the way they feel, it translates into better health because they're more likely to be active, to go out, to exercise, to do things. And all these things, those exercises, going out, and stuff like that, going dancing, going golfing, going partying, all these things, dancing, these are exercises that render them more active, and in return, they remain more healthy.
I am back to that old self, and I really feel like that I have kind of topped out for everything I dreamed of in my career, and I don't think I would have been able to accomplish this without being balanced and having a work-life balance that getting a efficient hormone replacement therapy care plan has given me.
It is one of the most gratifying experiences for me as a clinician, as a female pelvic medicine doctor, or as a urologist. When I take a patient who's really, really down, who comes to me, it's like, I'm completely down, I feel I'm a different person, and then you restore their hormone, and then they come back, they say, oh, look what happened to me. I'm a different person. I want to be closer to my spouse. I want to do things. I'm happier. I'm in a better mood. I want to do things. I am focused. I feel young again. That's the most common. I feel I'm young again. I feel I'm when I was 25 years old. And these are the wonders of science. These are the wonders of medicine.
The message I have is that don't wait until the symptoms get so severe. Go ahead and talk with your physician and have your hormone levels drawn and see what the balance actually is. It may not be menopause that you're treating. It's just one of the things. It was my story, but there are probably a number of other things that the bioidentical hormone replacement can help alleviate for the female today as well. And I would urge everybody to not wait too long until the symptoms really interrupt your life.
The message is, don't feel you have to suffer through it. Don't feel you are alone. Almost every woman has to go through it. It's part of aging. There's nothing to be embarrassed. There's nothing you did wrong. It is a normal part of aging. Life changes. Go get help.
I do still paint whenever I get the chance, and I'm looking forward to hopefully someday soon, as I finally decide that I can get off the hamster wheel, being able to paint a lot more, and maybe somebody might actually pay money for one of my paintings. That would be great too.